Welcome to The Explainer. Today, we're going to go behind the siren to explore the split-second decisions that first responders have to make. These aren't just medical choices. They're governed by this complex web of laws that can mean the difference between life, death, and a lawsuit.
Okay, so picture this. You're an EMT, the siren's wailing, you're trying to keep your patient stable, and then they say this to you. This isn't some made-up scenario. For EMTs, this is a daily reality.
So what do? I mean, your gut is probably screaming one thing, but the law might demand something totally different. To really get why, we've got to start with the very first question an EMT has to answer on every single call.
Before any medical care starts, before even a single question gets asked, everything, and I mean everything, hinges on one crucial legal and ethical principle: consent.
You see, at the heart of all this is a core idea called patient autonomy. It's just a fancy way of saying that every conscious, capable adult has the absolute right to decide what happens to their own body. Period. Even if that decision seems completely wrong from a medical point of view.
But wait, how does an EMT know if someone is actually capable of making that choice? They have to make a lightning-fast assessment of what's called decision-making capacity. Are they old enough? Are they impaired by drugs, alcohol, a head injury, maybe even just extreme pain? It's a huge judgment call they have to make in seconds.
And that assessment sends them down one of two paths. On one hand, you have expressed consent. That's the easy one. The patient says yes, or maybe just holds out an arm. But on the other hand, you have implied consent. And this is where it gets really fascinating. This is for when a patient is unconscious or can't think straight. The law basically steps in and says, yeah, we assume they would want help. It's this powerful legal safety net. Okay, so what happens when the patient is perfectly capable of making a decision and their decision is a firm no? Well, when a patient says no, it triggers this whole strict protocol. It's like a really careful dance. They have to explain all the risks, try to persuade the person, and if they still refuse, they have to document everything. I'm talking signed forms, witnesses, the whole shebang. Every step is a defense against a potential lawsuit down the line. But things can get murky. In those gray areas, when it's not totally clear if someone has the capacity to refuse, the guiding principle is pretty simple. Err on the side of saving a life. It's a huge burden, because failing to treat someone who really needed help carries an immense weight, both legally and ethically.
Now, sometimes the biggest life or death decision was already made long before anyone ever dialed 911, and it's all written down in a legal document.
These are called advance directives. Think of them as a patient's voice when they can no longer speak for themselves. And the one EMTs deal with the most is the Do Not Resuscitate Order, the DNR. But here's the thing. An EMT can't just take a family member's word for it. Not a chance. For a DNR to be legally valid, it has to be a physical document and it has to check all the right boxes, signatures, dates, all of it. If they don't have that valid paperwork right there in their hands, they are legally obligated to start resuscitation. And on the most extreme calls, EMTs are literally standing on the line between life and death. They're trained to look past what are called presumptive signs, like no pulse, and identify definitive signs, unmistakable proof like rigor mortis. Once they see those definitive signs, their duty shifts completely from resuscitation to preservation, because at that point, any intervention would be pointless. From the moment they arrive on scene, an EMT becomes a keeper of secrets. They're handling highly sensitive personal information that is fiercely protected by federal law. And that legal shield has a name I'm sure you've heard: HIPAA. It's the huge federal law that's all about safeguarding patient confidentiality, and for EMTs, it's something they have to think about constantly. Under HIPAA, pretty much everything is considered protected health information, or PHI. It's not just the medical stuff. It's a patient's name, their address, literally any detail that could be used to identify them. And in today's world, this is a massive deal. A casual post on social media about a crazy call, even without a name, can be a major violation. Sharing war stories online or posting a picture from a scene, that's not just a slip-up, that is a career-ending legal and ethical disaster. Now, you might think that once the patient is safely at the hospital, the EMT's job is done. But actually, their legal risks are often just getting started.
You see, once an EMT is dispatched or starts treatment, they establish what's called a legal duty to act. Unlike a random bystander, they can't just change their mind and walk away. They are legally obligated to provide care. And that care has to meet a certain standard of care.
If an EMT fails to provide the same level of care that another similarly trained EMT would, and that failure actually hurts the patient, they can be accused of negligence.
But proving negligence in court is incredibly difficult. A lawyer can't just show that a mistake was made. They have to successfully prove this entire chain of 4 events: that there was a duty, they breached it, the patient was harmed, and that the breach directly caused that harm. If even one link in that chain breaks, the whole case just falls apart.
So that chain of care has to be continuous. It starts at the scene, and it doesn't end until the patient is officially transferred to someone with equal or higher training, like a nurse or a doctor. Just dropping a patient off in the waiting room, that could be considered abandonment.
But all these laws and procedures, they're just a map. What happens when the map runs out and all that's left is a really difficult human judgment call?
Because ultimately, being a first responder isn't about following a legal checklist. The law provides a map, but every call is new terrain. They're forced to answer a question that all of us struggle with. When does a person's right to choose for themselves end, and our duty to protect them from themselves begin? The difference is, they have to find an answer in seconds.